Good morning. Thank you, Tamar and Mark, for organizing this, and Sue and Ray. This is a great conference that we have every year. And I'm going to start off today talking about ACL prevention. ACL injuries are a big epidemic. We see them with a lot of our youth athletes and adults. And I'm going to really focus on the prevention, but I will go through a little bit of ACL injuries themselves, why they're so important, why they're such a difficult injury to manage, and how we can prevent them from happening. So to quickly look at the anatomy of the ACL is a ligament in the middle of the knee, and it's one of the two cruciate ligaments that cross the knee and help stabilize the knee. It's right here in the middle where that probe is pointing, and you can see that it is right here. And we'll continue to look through. As we look at the anatomy, right here the ACL sits in a notch, and that notch is important when we look at some of the risk factors of why people may be at a higher risk of having ACL injuries. This is a little video that shows how the ACL functions, and its main goal again is to stabilize the knee, keeping the tibia centered on the femur so it doesn't move forward. And that was the ACL right there. I'll show you that one more time so you can see the ACL is this structure right here. So as we focus on our injury prevention programs, we're looking at the mechanism of that ACL. We'll look at the risk factors, why they rupture, and focus all of the prevention on those specifics. So when we look at the ACL, it's the second most commonly injured ligament in the knee. The MCL happens more commonly. We see that the incidence of these injuries is increasing, and there are a couple reasons. One main reason is the increase in youth sports, and we see it a lot, particularly in our female athletes, but in males as well. And part of that can be related to the increased number of kids participating, and also the level of participation where we're seeing really year-round sports can be a contribution. We do know that women are at a higher risk, and that risk can be up to 9 times. Probably the most commonly reported is around 6 times higher risk than male athletes. And a lot of these injuries also have associated meniscal tears with them, and those need to be addressed at the time. So the most common mechanism of action for these injuries is non-contact, meaning it's not just a football injury where athletes are hitting one another, but it's a non-contact injury, often with the foot planted and the knee partially flexed, and a pivot injury. The other mechanism we see is where the knee is hyperextended, meaning fully straight, and the knee goes valgus. That's kind of knock-knee position, and that's going to be something we focus on a lot today in prevention. Is that knock-knee position called valgus is one of the high risk factors for these injuries. Athletes will often feel a pop and develop swelling in the knee. This video here shows, we're going to look at athlete number 7, who's going to come up right here, plant that right leg, and she'll go down right there. And that's that mechanism where we see that ACL. That injury is so significant because this athlete is now out of sport for 9 to 12 months. And that is a huge impact on an adult athlete for sure, but it's definitely an impact on some of our younger youth athletes, taking them out of something that's positive for them, confidence, it's their team, and that has a huge impact. And so as much we can do to prevent that, taking them out of there and keeping them healthy, it also has risk factors for the knees going forward in terms of developing arthritis. So we really want to focus on what can we do to prevent these injuries from happening. Some of the risk factors, again, females are a higher risk than males. The size of that notch where that ACL sits, the anatomy of the knee can also play a role. High risk sports, and then the mechanics of the individual play the most important factor that we can really change or alter. Again, women are at a higher risk of having an initial ACL injury. They're also at a higher risk of having a re-injury. So we need to really focus after an ACL injury on the rehab to make sure that we prevent some of those mechanics that may contribute to a re-injury. Looking at some of those risk factors, the anatomy, that notch right where the ACL sits in the middle, does tend to be smaller in females. And so that places it at a slightly higher risk. If an athlete tends to be pretty loose jointed, that's another risk factor. And then valgus knee, where that knee is knock-kneed, is a high risk for having ACLs. Here's a picture of two athletes, two individuals. This is female on the left and male on the right. And you can see that knock-knee position, again, puts that ACL at risk. And a lot of the prevention programs that I'm going to look at will focus on stabilizing the knee and limiting how much that knee drops into that valgus position, particularly with landing, squatting, lunging, so that we can protect the knee. If you look at these two pictures, on the left we have a group of female athletes and on the right we have a group of male, and what you can see is the big difference in terms of the knee position. The females, really their knees do kind of collapse together, and we don't see that as much as the males. Part of that is anatomy. Part of that we can address with physical therapy, with exercise programs that minimize that and protect the knee. There are high-risk sports: soccer, basketball, volleyball, downhill skiing, football. Not that the kids shouldn't participate in those sports, but we need to be aware of those sports and particularly address those athletes who are participating in those sports so that we minimize their exposure and their risk of having injuries. So when we look at some of the programs that we focus on, it's a neuromuscular control, and that's how we control our knee. We want to look at that. Some of the risk factors, again, are increased valgus. So when our athletes land and their knee goes knock-kneed, that's an increased risk. When they have poor core control, so their abdominals, their core muscles are not as strong, and when they're what's called quadricep dominant, that means that the quads are stronger than the hamstrings in general, and that puts the knee at risk, because what that does is pulls the tibia, your shin bone, forward, and puts that ACL in a higher stress position. So the exercises that we focus on are trying to change that position, and you can see the athlete up on top is more upright, and the athlete down here is in a more athletic position, being more flexed at the hips and knees, and that is a safer position. So some of the exercises we'll focus on are preventing our athletes from being upright, particularly when they're playing, but also when they're landing and jumping. And you can see here, as this person is demonstrating jumping, those knees are dropping in. That is going to put that athlete at risk of having an ACL injury. So when we look at sports, we want to do everything we can to prevent injury. So we're going to look at it from all different directions. There's a lot of talk of ACL prevention. This is a field surface. Do braces work? There's no study that demonstrates that braces are effective in preventing ACL injuries, so we do not recommend that at this time. Field surfaces, we do know that a higher friction between the shoe and the surface can increase the risk, but current turf surfaces do not increase that risk, certainly not at a point where we would change those surfaces or recommend not playing on them. So the main thing that we can really address are the mechanics, the strength, the core strength, the hamstring strength, and the position that our athletes are when they land and jump. So the ACL prevention programs focus on two main categories: neuromuscular training and plyometric training. And what they're going to be focusing on in the neuromuscular is core strength, enhancing the mechanics, control, and power, and improve the stabilization of the knee joint. The plyometric trainings are going to look at strength, coordination, power, speed, and mechanics, and they're really preparing the soft tissue, the muscles, for the technique of the specific sport. These ACL programs, and there are many different programs, and I'll show a few, one of the, I think, mistakes that we make, or things that we're not good at, is these programs need to be started at a young age. Starting these programs in college is certainly way too late. Starting them in high school is too late. These should probably be initiated before puberty starts, particularly in our female athletes. So we're talking 8, 9, 10 is an important time to introduce these into our athletic programs at school, in the community. Travel sports is when these exercise programs really need to be introduced to the children. They should be started in preseason. So starting them halfway through the season, we've kind of missed that boat, but starting them at least 6 weeks before season starts is an important component, and they should probably be performed at least 3 times a week. These are a few of the different programs that are out there. There are a lot of different programs. Some have been proven to reduce the risk of ACLs, some have not. FIFA 11 is probably one of the most popular. It has demonstrated 35% fewer injuries. That's important. That's a key number for our athletes. There's a PET program is another one that also has shown approximately 40%. And there's another one called SportsMetric, and there are a lot of other programs out there. I think the key is to look at these programs, find ones that have demonstrated a reduced risk of injury, but also ones that are applicable on the field and for our athletes. We can't have our athletes be doing an hour program before practice because their practices are already tight, and the coaches are working on technique as well. So we do need to have something that they can apply to their sports. As I talked about a little bit, that valgus knee position is the biggest risk. So these programs are all going to focus on that position. And that is, we know, controlled by the hip and core muscles. So a lot of these programs are going to focusing on strengthening those muscles. This is what the FIFA 11 program looks like when you just look at the sheet. And I know that's a lot, so I'm going to break it down a little bit. It basically starts with an 8-minute group of running exercises. And these are exercises that the coaches can do on the field with kids before practice. It then goes, and I'll look at some of these a little bit more closely, but then it goes and looks at some of the strength, plyometric, and balance. And you can see the first was 8 minutes, this is 10 minutes. Should not be a huge part, but it does still take some time. Here are a few of the exercises, how they describe them. And the last set are some running exercises. You can see on the bottom, they demonstrate here the importance of proper form. And that's going to be the key to doing these exercises, is that you're not just rushing through them, but you're really looking and the kids are doing them with proper technique. What we've done at ONS is we've worked a lot with our physical therapists on some of these programs and introducing them into the schools. How can they take that FIFA 11 and make it applicable to our high school, our middle school students, so they can do it before practice? It's easy for coaches, athletic trainers, and directors to really introduce. Alicia Hurst and I have worked with some of the female schools and looked at one of the apps that we use for our physical therapy athletes who are recovering, and our physical therapists are able to give this program to their patients so that they can do their exercises at home. What we've done is taken that same app and put together a group of exercises similar to the FIFA 11 so that coaches can have this real time on their phones, on the field, and take their athletes through it. And it's a great, fast way, and they can actually pick some of these if they say, today we don't have time for whatever reason, they can pick some, but we've basically put together those top exercises. And I have a couple of videos to show how it works. And you'll hear that it does take you through description of form, technique, and it's an important thing.
In a long, flat, open space. Move forward with quick, small steps, bringing your knees up to waist height each time. Make sure to keep your movements controlled and maintain.
And here's one more.
Begin.
So again, this just takes us through those exercises and has it right there in the field so that our coaches can really apply it and use it with the athletes. Because again, we fix these, but we want to do everything we can to prevent our athletes from having these injuries. So ACL prevention. ACL injuries have a very large impact on our athletes. As I said, it's 9 to 12 months back to sport. So anything we can do to prevent these injuries from happening is very important. The programs are effective in reducing the risk and reducing ACL injuries. These need to be initiated early in an athlete's career and early in a season, before the season starts, to be effective. And they really do need to be performed 2 to 3 times a week. So it's something that we need to work with our community teams, our travel teams, our school teams, of what is the best way to introduce. I think introducing them in the middle school age group is important so that the kids learn them. They understand this is part of it. It's like a seatbelt. No one here questions whether or not they put their seatbelt on in the car. If kids learn this at a young age, they know that that's part of their training to prevent those injuries, and then they won't be coming in the office to see us. Thank you.